Hey everybody, I'm Venomous, and this is my hetero life mate.
Titan.
And welcome to the Shoulda Known podcast, where we reflect on our life experiences and share with you what we wish we would have known to navigate through life's rough seas. So, Titan, I'm going to hand things over to you to tell the audience what they can expect from today's show. What can they expect?
Yeah, so today's show is going to be talking about some of the effects that our life partners' health has had on our lives and our careers and families, because both of us have people in our lives that suffer from some pretty chronic health issues. And so we'd like to kind of talk about that, and maybe it can help people who maybe have similar issues.
Awesome. Great. And if you guys are experiencing chronic pain or you have a loved one who is, we would love to hear your story as well. All right. So, Titan, this is probably a little bit of a spoiler alert, but how long were you with your partner? Because you guys are no longer together, right?
Yeah, so recently divorced as of a few months ago, but we were together almost 20 years. So how long you been with your significant other?
For about the same. Yeah, pretty much about the same. Probably like 24 years. So that probably makes me really old at this point. I am an ancient in modern terms. So old. So what kind of health issues did your partner suffer from while you were together?
Yeah, so it's kind of sensitive to how I explain it, because I don't want to give away too many details in some ways, for that own person's benefits. But some things that they suffer from: chronic migraines. They had some mental health issues, issues with their thyroid, things of that nature. And I mean, like the migraines, it was something, and the reason why we say it's chronic migraines is because it was several times a month for several days at a time, with nausea, sound sensitivity, light sensitivity, basically just laying in a bed for, a few days. And that would, like I said, happen a few times a month. So that was the biggest issue that they had.
Now,
yourself, Venomous, what kind of...
Did they have the chronic issues when you first got together, or is it something that kind of came about over time?
No, they didn't when we first got together. I mean, they would have migraines, but it wasn't as frequent or as strong. I mean, they'd have them, but like a day, take some over-the-counter pain, Excedrin migraine or something like that, and it would be fine. It was something that happened after a couple of years of us being together, as when they started off getting more frequent, having to go to the ER actually to abort the migraine, because nothing over the counter would help. And then after our child was born, that's when they got even worse.
Mm-hmm.
It was during the pregnancy, even it was often and frequent. So,
yeah.
But yeah, so and it did eventually. We did get some relief. We did find some medication a few years ago that did reduce the frequency of the migraines, but it didn't completely make them go away. But hey, even reducing the frequency was better than what we had. It was down to like one time a month for just a couple of days versus 3 or 4 times for a couple of days. So
yeah, and that can't be fun, going to the ER to find relief, right? Like, even you as a spouse, what was it like for you, having to, deal with somebody that is frequently going to the ER because there's nothing else that you can really do to get the, the pain or the situation under control?
Yeah. Right. Yeah, I mean, it was really tough. You had at one point we were going like 3 or 4 times a week. Actually,
Oh wow!
I think at that time
it's a lot.
They were actually more. I think they were kind of, yeah, and I think they kind of got it. I hate to say the term addicted, but I think that they were getting used to the medication that they were receiving there. So they would basically have what they call rebound migraines. So you get some medication that helps get rid of the pain, but then it just comes back. So I think that was kind of happening. But at one point, in the early days, I was in the military, and at that time we had to use TRICARE, and with TRICARE we would go to the ER and we would have to
And
sit.
what's TRICARE
Sometimes we
for
would
those
sit
who
for 6 to 8 hours.
what's TRICARE for those who don't know?
Yeah. So it's the health insurance that the military gets.
Mm-hmm.
So the military spouses and the military members, they receive with TRICARE. So it's like Blue Cross Blue Shield or some other health insurance company. TRICARE is what everybody has, and so then you're kind of limited on where you can go as far as ERs and things like that. And so when we'd go to the ER, sometimes, like I said, we'd sit for 6 to 8 hours, sometimes before even being seen by a doctor. That was sitting in the waiting room, which was loud and well lit, so that would not help the migraine situation.
No, not at all.
Once we got done, and then so that was awful, from a spouse, just sitting there point of view. But then once our child was born, we had let's see, what was it? Sorry, saying a lot of ums.
Yeah, take your time.
Once our child was born, then I would have to take care of them while sitting at the ER or waiting in the ER, and that adds a whole nother layer of complexity dealing with that. Also, it affected me personally, I guess, because when they would have migraines and they're down, that's where I have to step up and do more of the things around the house, again, taking care of our child, things like that. And it got to a point where they couldn't work, so I was the only source of income because they couldn't work.
Right.
So that adds a whole nother level of stress on top of everything.
Yeah, of course. Yep. Yeah. So, with my partner, her health issues pretty much started right from the get. And it was weird because initially when we first got together, it was one of those things where she would have, stomach issues. So she went from having stomach issues, and then that became, once that seemed to get under control, then she had migraine issues, as you're well aware of. And then after that, it became back issues. Now, over time, what we've been able to determine is, so we got the migraine thing under control. She was drinking too much diet soda, and the artificial sweetener is what was causing her migraine. So once she was able to stop that or get that under control, the migraine stopped happening. Stomach issues, she still has stomach issues. Stomach issues tend to run in her family anyway. So that's kind of, so that's, you deal with it as it happens. But then the back issues is interesting because she's got multiple back and hip issues. So one of the issues that she has is that she's got arthritis in her hip. When she was diagnosed with that, she was still super young. And that's usually not something that you get unless you're elderly, right? So for her to have arthritis in her hip that young is very, very unusual. Another issue that she's got is she was born with it. It's a congenital issue with her spine, and it's an issue that I think it was her grandpa who also had as well. And she's got, as a result of that, she's got a degenerated disc. So she's got and I went to a doctor's appointment with her last week, and the doctor took a look at some x-rays that they did. Actually, it was an MRI that they did. And he pointed out, hey, listen, if you see this down here, that's a degenerated disc. It's got a lot of wear and tear. That could be, that's one of the things that contributes to your back pains. But then she also has issues with her sciatic nerve. And so what traditionally tends to happen with her is that she'll have flare-ups. She'll be perfectly fine for a long time, and then all of a sudden she'll have a bad day, or the weather will change, and her back will all of a sudden start hurting a lot. So in those cases, what ends up happening is she's basically just laid up on the couch or laid up in bed, and really she's got no real mobility until it passes. And so usually now we're pretty much at a point we've got it mostly under control until this last flare up, which I think is more than just a flare up. I think this go around she really did injure her back. So now we've got to do corrective surgery to fix it. So that's kind of how, my partner's been affected by her chronic pain. And for me personally, you know, it's been kind of an emotional roller coaster because I'll be the very first to admit I'm not perfect. But at first, I kind of felt angry and resentful.
What?
Uh, I know, right? It's
I
crazy,
disagree with you.
crazy, crazy, crazy. And then, and then, and what I found over time is, and I don't remember where I heard this from, but like anger is an emotion based
Mhm.
in fear. And so I started thinking about, okay, well, what am I afraid of? Right. And really, what it came down to for me is just that helpless feeling that you get because here's somebody that you care about a lot, that you love, and there's nothing you personally can do other than being there for them. So that's kind of how I was personally impacted and continue to be impacted, right? Because it still sucks. Like I still hate seeing her in pain, and because normally she tends to be very active and she's very productive, and just seeing her like that, it's not fun. It's tough.
So I can definitely relate to you and how you felt, especially when you start talking about the anger and the fear, especially of the unknown. For me, one of the things that was difficult was that I didn't know what was causing the migraines. Could it be a tumor? It could be increased spinal fluid pressure. It could be the loss of spinal fluid pressure. Could be lots of things, right? Blood pressure, yada yada. But the thing that we found out is that when it comes to migraines, if it's not a tumor that they can see on a scan and it's not something they can measure through a spinal tap, which my partner had lots of spinal taps over the years, they really, in my opinion, really don't know what's causing the
Sure.
migraine. They just kind of start throwing different medications
Yep.
at you, which can get really frustrating because those medications a lot of times had adverse side effects. I remember there was one that won't be named, but it affected their short-term memory. It made it so that they couldn't remember. Like they'd go into the
That's
grocery store and they'd
scary.
forget why they went to the grocery store. Yeah, yeah, it was really bad. They were on another medication at one point that actually ended up causing them to have seizures. Now, it wasn't the kind that I think they call grand mal that cause you to, kind of thrash around, but it was, they would be in the middle of doing something, telling you a story, and then just stop for like 2 or 3 minutes
Wow.
and then start
Yeah.
going again as if nothing had ever happened, which was really scary because like, okay, well then you can't drive,
Right.
and especially with our child and stuff, it's like, yeah, you can't do that. And so that definitely had a level of fear for me, and definitely had some anger, and I think something else that made me angry a lot of times, and it wasn't their fault, and I tried not to ever take it out on them, but sometimes you get frustrated and you get short tempered with something, and and it does kind of come out. But it was just the fact that it's like, okay, I'm working this job and now I'm taking care of our child, I'm cooking, I'm cleaning, I'm doing all these things because they're down with a migraine, and it's like, okay, now they're better, but then just a few days later they're down again.
Right.
And it's like,
Right. Here we go again.
it
Yep.
just felt like the whole world rested on your shoulders. Yeah, exactly. And so that whole world resting on your shoulders feeling sucks. So
Yeah.
don't like it.
Yeah, I can relate to that.
But
So, what kind of? Go ahead.
the other thing you said that's funny, I'm sorry. One other thing you said that was really interesting is you talk about the weather affecting them as far as their back and stuff. That actually happened also with us. Is that the weather, if it would especially big storms came through or whatever, and change in barometric pressure would cause them to have a migraine. So imagine springtime with showers and stuff. It was a fun and active time for migraines whenever you'd get the kind of rainy part of the year. So when we talk about the pain and how they were down and stuff, how'd that affect your children?
So, for the most part, the kids have always been pretty understanding, and in a way, they've kind of gotten used to it. So, whenever she's got a flare up of some sort, they step up to the plate. They help out with their little brother, and they help out around the house, and they're pretty self sufficient at this point. But that doesn't mean that they're not worried for her, right? So there's definitely that aspect to it where they're worried about their mother, they don't know really what's going on. Um, and so what I try to do and what she tries to do is we try to keep them in the know as much as possible. So whenever we're in the ER, We try to let them know, hey, here's what's going on. Here's how much longer we think we're going to be here. That way, they're not in the dark and they kind of feel like we're being open. Well, and we are. We're being open and transparent with them as much as possible. Now, usually, when she does have a flare up, it's only for a couple of days. So we all know how to handle the situation. It's only for a couple of days. There's a particular medical regimen that she's going to be on, and then she's fine. But yeah, I don't know what the long term effects are going to be on the kids. Right. All that we feel we can do at this point is just listen to them whenever they have a concern, and be as transparent with them as we possible can be. Now, one piece that was really difficult for us was, you mentioned that your partner was hooked essentially, right, on the meds, and the same thing happened with mine. The traditional treatments for this type of chronic pain is twofold. One, it's opiates, right? So, so that's one of the things that she was constantly on. The other thing is they do injections in the back that are supposed to last for several months at a time. Well, with my partner, the injections just didn't work at all. So she would go in, she would have this procedure where they would shove a needle into her spine with some medicine in it. I think it was cortisone, I think is what they would put in there. And it was just a waste of time. It was a waste of money because it didn't do anything. And the only thing that seemed to help was the opiates. And at the time, I would listen to a lot of Dr. Drew. You remember Dr. Drew from what it was, a Loveline?
Yeah, Loveline.
Yeah. So I don't know if he still does this or not, but he used to have a podcast all around, mental health and, drug use and stuff like that. And he would cover opiate addiction a lot. Now, the way that he covered it was from an empathetic perspective. A lot of doctors are not empathetic about opiate use. They believe that the patient is to blame for their opiate addiction. Whereas Dr. Drew kind of, he from my experience, for him, it was a split responsibility. And one of the things he talked about a lot was that opiates tend to amplify the pain. So yes, does it mean that you're not in pain? No, it doesn't mean that you're not in pain. You're certainly in pain, but the opiates would make them worse. So I started talking to my partner a lot about, okay, well, let's start minimizing the amount of opiates that you're on. Let's start getting you off of them, blah, blah, blah. And she would push back a lot, right? And she would give me the whole, well, you don't think I'm in pain, or you're not taking me seriously, da 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 da. Like, this is the only thing that I can do to be comfortable and have a life. And eventually she realized too that she just couldn't live like that anymore. And she went in to not rehab, but it was detox. So we made arrangements with her mom. Yeah. We made arrangements with her mom, and she was basically in detox for over a week, where they monitor, they had medical staff there. They would monitor her. And this facility was part of the hospital. So if she ended up in medical duress of some sort, they would have the facilities there to treat her. But yeah, she was in there with hardcore drug addicts, man. Like, these people were out on the streets like every day, just looking for the next fix. And the good thing for her is that they put her, it's interesting. In order for you to get over the opiate addiction, they put you on a different opiate. And I can't remember what it's called now.
Right.
But they put you on, it's Suboxone, I think is what it is. And it's supposed to be like the lesser thing, the lesser evil, if you will. And she got on that. And then eventually she got herself off of that.
Methadone, I think, for heroin.
Yeah. I think you're right. Yeah, I think you're right. I think you're absolutely right. So over time, she just, she got off of it. altogether. And now she only deals with the flare ups as they come up. So anyway, I know that, I know that was a lot, right? But just it's the issue is a complex issue, right? There's a lot of different facets to it. So sorry if I, you know,
Right.
if I went on there too long for everybody that's
No.
that's listening to this or watching this, but there was definitely a lot that happened.
Yeah, no, I completely understand, and had similar things. For going back to the children. We only had the one, and for them, I think the thing that affected them, one was, when they were little, it was difficult because it's like, your mom's down with a migraine, you got to be quiet, you got to do all that, which then made our household very quiet. Like,
Yeah.
it actually made it so when they would go to preschool and stuff and be around kids, it was loud environment. They actually would cry all the time. They complained that it was just so loud because they were used to being in this quiet house. Because it was like, oh, don't be too loud, mommy's got a migraine, kind of a thing. Which is, I kind of feel bad for them as a child because they didn't get to be a child and play and bang on stuff. Not that I really would want them to anyways,
Right.
but, they kind of lost that ability. And the other thing you talk about when you talk about opiates, she was on some opiates, but differently. They were, it wasn't like, I don't know. It was a little bit different scenario. Typically, it was just stuff that she would get at the ER that was pretty heavy stuff. But what was interesting that we'd run into a lot of times when you talk about the doctors is them thinking she's just there seeking drugs.
Oh my God, that's the worst.
They kind of push back and it's like, oh, they don't want to give you anything. They don't want to. They think, oh, you're just here trying to get more drugs, and it's like, no, they're in pain. And the problem with any of these kind of, especially chronic pain issues, how are they going to test for it? How can they tell you're in pain other than your blood pressure is
Right.
high?
Exactly.
Things that could cause that, and so, what's funny is the one thing not to give advice, but in my opinion, the one thing I found is don't just take doctors for their word. Push back.
Yes, 100%.
There's a lot of times where, maybe they're having a bad day, or maybe they're just not that knowledgeable. Who knows? I know one time I had an ER doc try to tell me that they didn't want to give pain medication because of rebound migraines, which I know were a thing. But I was like, listen, I don't know what your experience is with migraines, but we've been dealing with this for almost 15 years now. So I think we know more about it than you do at this point.
Yep.
We're telling you that this, what they call migraine cocktail, will fix her. She'll go home, she'll sleep for, 8 to 10 hours or whatever, and then she'll be fine. Like, that's what we do. We fight these until she's been not eating for 4 days because she's been throwing up. And it's like, okay, well, we have to go now. And that was kind of the regimen. So, you got to take some of the healthcare stuff into your own hands, do your own research a little bit, and that way you can go armed with some information. Don't get crazy with WebMD, because then you're going to find out you have cancer, because that's what everything leads to on WebMD. Everybody starts, we got a runny nose, oh, you got cancer.
Yeah.
But definitely at least do some research. And that's how I found
that's so true, dude.
It did end up start helping a little bit. Yeah. But anyway, so that's just the way I look at it. I pushed back on several doctors, and I mean, I've been threatened to be kicked out of a couple of ERs, but I'm never rude. I don't curse at them, except for one doctor, and that's because he actually caused her to have a reaction because he mixed medications together that shouldn't have been mixed. But that was a whole other thing, and that was a long time ago. But one thing that I think that's important with all of this is, what has this impact been like on your relationship with your significant other? How has that, caused problems between the two of you, whether it's, just being able to spend time together, do things together, stuff like that. I mean, I know for me, it definitely caused a significant impact, especially as it went around our relationship.
Yeah. So for us, it's just whenever she is and whenever she's having a flare up, and I hate calling it a flare up because it's not, I feel like that kind of minimizes what's going on, but it's not, it's temporary, right? So, I can't think of a better word of saying it.
That's when the pain, I would think it's probably more like, it's when the pain, she's always probably in pain.
Yes,
That's the problem,
absolutely,
right?
100%.
But it's when the pain's so bad that she can't deal with it anymore is the quote unquote flare up.
Right. Exactly. Exactly. So that's it. Man, you just described it perfectly. So, at first, her issues really created a lot of strain in our relationship. Um, and I told you a little bit earlier about resentment and anger and all that sort of stuff. So, but again, like looking at it in context, for me, it was one of those things like, well, she's always been sick with something, right? It's always been something with her. It was the stomach issues, it was the migraines, it was this, it was that, and
Yeah.
she kind of had a little bit of a history of being a little bit overly dramatic, right? Like her mom would always say, "Oh, you're just making a big deal out of nothing." Now I'm a little bit older. I'm a little bit wiser. I know her family dynamic a little bit better now, and um, I wish what I could have done is been perhaps a little bit more understanding at the time. Now I am 100% like all in. Like, you need the time, take the time. I'll do stuff. I'll pick up the slack. Me and the kids we'll pick up the slack. Don't worry about a thing. We got things covered, and just let her rest. It just means that whenever she's got this flare up, her ability to do things, period, are just negatively affected. Now, when she's not having issues, she's super productive. Like, she gets a lot of things done. Like, I would not be where I am today career wise if it wasn't for the fact that she's so involved and she handles everything else, right? Like, if it's not work related, if it's not work related, she's taking care of it. So
Yeah.
for that reason alone, right? Like, I've got to, I'm there whenever I can, and if I need to take her to the ER, fine, I'll take her to the ER. Gladly take her.
Right.
Well, not gladly, but I'll do it. No complaints.
You just kick her out the door as you drive by. Is that
Exactly?
See you later.
Exactly. Well, there was a couple of times where I'm like, gosh, can't you get yourself to the hospital? Or can't I just drop you off? Because I don't want to sit there all day. Like, we'd have that conversation, going back to things I wish I had done differently. That's 100% one of the things I wish I had done differently. Now, did I ever just really drop her off? Not really. I think there was a couple of times where I did, just because like we didn't have anybody to watch the kids and the kids were younger. But like, now that they're self-sufficient, that's not something that even crosses my mind anymore. So.
Well, that's a good way to make me feel like a jackass, because I definitely have dropped her off at the ER because it got to a point. I mean, I think in the, like I said, 20 years we were together, I probably was at the ER about, I don't know, 200 times.
Yeah, that's a lot.
And that's just for the migraines. That didn't include other reasons. So she has other stuff, and it's interesting because any of the other medical issues, I always say at the ER. We found a way to deal with it. At one point, we lived. We didn't have any relatives nearby, and so we actually found a daycare place that was open like super late. It was kind of like a pay by the hour drop off daycare, which was really great. And so we would use them a lot of times for the ER visits, for that kind of stuff. But it definitely got to a point later on. It was like, okay, well, I'm sorry you have a migraine, but it's the same thing. We deal with this all the time. You don't need me there. We know you're not, yes, you're in pain, but you're not dying from something that you need me there. And it was just, I didn't want to spend, hours on end sitting in the ER anymore.
Sitting there. Yeah.
Like I said, kind of made me feel like a jackass for saying it. But honestly, COVID was awesome for me for that, because then I had an excuse because I couldn't stay. Well, sorry, they say I can't stay, so I'll see you later. But it, and the way, so, it's funny that you talk about, your partner and how they were very productive when they weren't feeling bad, when they weren't down or having the issue. And in the beginning, it was that way for me and my partner. And, like I said, we're no longer together now, so I have to be careful. I don't want to say anything that's going to make her super angry, but everything I'm about to say is 100% true, and she would agree, is that as time went on, it, I think, significantly impacted her own mental health with depression and things of that nature.
Yeah, no doubt.
That it became harder for her to do things. And honestly, the last, 5 or 6 years we were together, it was really just me doing things, between cooking and cleaning and taking care of the bills, taking care of the house, mowing the grass, working, taking care of our child, which by then he, was old enough, didn't really need to do much with him, but at least see after him and stuff. And so that's what caused the problems for us. It wasn't because she had the issues that it was like, well, I can't be with you anymore. I'm tired of dealing with your issue. It was because when she wasn't down with, the migraine, she still didn't do anything.
Yeah.
And it got to be at a point, when I tried, we tried fixing it. We tried to go couples counseling and stuff like that. And it never changed. It didn't improve. And after, like I said, like 5 years, it was like, okay, I can't do this anymore. So, obviously it definitely impacted our relationship from that standpoint. But even earlier on, some of the things that it did is you couldn't plan anything. It's not like I could say, oh, let's go get tickets to go to some concert, because there's a chance we couldn't go because she'd have a horrible migraine, or we're going to take a vacation and go somewhere. And it was always like, oh my God, I hope she doesn't have a migraine, while we're on this vacation. And we got lucky, and that didn't happen that often where it, completely ruined our plans, which was always kind of interesting that it worked out that way. But I mean, it definitely did happen a couple times where we're on a vacation trip and then she's basically just felt awful for like 2 days of that trip. So we'd have to rearrange, maybe, what things are we going to do on that trip and change what days we're doing them in order to do that. So I, would have to pay extra for cancellation, free cancellation and things like that, just to make sure we were always covered. But
good grief.
So yeah, that was always difficult from relationship. And then, intimacy was another one. I mean, if you're down with a migraine several times a month, again, on top of other medical issues I don't want to really go into, it makes having, an intimate relationship really difficult with your partner. So, and that's, you kind of have to have some form of intimacy because it's, in my opinion, it's really important between, a couple. So
yes. I mean, I think everyone puts a different level of importance on that, right? And I think everyone's kind of has their own way of dealing with it. But certainly, I think also that it is important. I mean, I absolutely.
Right.
Now, my situation was not as extreme as yours. I could go with a couple of days or even a couple of weeks. But I think your situation was definitely much more severe. And, my wife and I, when we are, we both enjoy being with each other. Right. And so it's yeah. So I feel for you on that front. And I agree. Right. Like, and we're still relatively young, all things considered. So, I could not imagine just living the rest of my life with a lack of intimacy. I don't know. I don't know if you ever watched Sister Wives. Did you ever watch Sister Wives?
No, I know of the show, but
you know of the show? Okay. So on the show,
I know I would never want more than one significant other. Like dealing with one's hard enough. I can imagine
same
multiples,
dude. Same. I could only deal with one at a time. One only. So on the show, so now all the marriages on the show are all falling apart. Okay. And with one of the sister wives, the husband told her that he has no desire of being intimate with her at all. None at all. And she was like,
oh, fun.
Right? So what does she do? She's like, I'm out of here. I'm done. Now, they had long-term relationship issues. And that whole dynamic to me is just not, it's too complicated for me. One relationship is too complicated, right? And you've got multiple relationships with like, I don't know how many kids they have, 10, 20 freaking kids amongst like all four of them 1, 2, 3, yeah, no, 4,
Mhm.
yeah, 4 sister wives, and then him, yeah, so 4 sister wives. So it's a lot. And yeah, so for
A
her,
lot going on.
she's what, in her 40s, early 50s, something like that. So she still has a long way to go in life. And she's like, no, if my husband
Right.
doesn't, my partner in life doesn't even want to be intimate, like I can't do this. So um
Yeah.
yeah, because it's not all, it's not, intimacy is not
me-
about the sexual part necessarily, right? It's also about being together, and there's more to it than just,
Right.
you know,
Yeah.
getting it in.
Yeah, it definitely. Yeah, yes, yeah, it definitely. Yeah, there's more to it than we can say sex. It's an okay. We can say things like that because we're not going to say this is for children to watch. So we can say the word sex, but uh, yeah, I mean, and it was interesting because it would go for a while, and it wasn't a couple weeks. I mean, it started out. It's like okay, it's a week, 2 weeks. And then, but the time kept getting further and further apart. And I mean, you get to a point, it's like, well, let's just see, it's like, because you get to a point where, it affects your, confidence, right? Because it's like it got to a point where I felt like I was constantly like, like, oh, hey, let's, maybe you want to do something. Like, no, I don't feel like it, okay. And I knew when she had a migraine, I knew she didn't feel like it. So I would never even try then.
Right.
But it's like, it's like after a while it's like okay, well let's see how long it takes before she even wants to, and it would go further and further and further. I mean, it got to at one point over a year, which is a long time to not have relations with your significant other, in my opinion. And that's where for me, when I look back, it's like maybe it was a midlife crisis to a point, but honestly, it's funny because it's like I again, I was the same thing. It's like I didn't want to live the next 20 years this way. And there was no indication it was going to get better. It was only getting worse.
Right.
And so, and what's interesting is that, when I talked to my son and told him that, we were going to get a divorce, he's like, well, I've been waiting on this for 3 or 4 years. And I was like, and he was like, yeah. And I said, well, that means I should have done it 3 or 4 years ago. I waited too long because he obviously recognized there were issues. And I guess I was kind of in denial about it or whatever. But yeah.
So go ahead.
The one thing, I was going to say, the one thing that I will say is that, early on I got, lucky. We talked in our last episode about careers and things like that. And, I did get lucky that at one point we lived right next door to her parents. And so it allowed me to take the journey I've been on from a career perspective because I traveled a lot, for work. I was gone for several days of the week at a time. And so, but I do know that her conditions affected my career because we would have to, we'd have to think about, okay, well, where are we going to live? We got to try to not be anywhere that's going to, weather wise or, things like that, or, make sure that we're near places where we're going to have, good doctors and, good medical care, things of that nature. So it definitely affected some of the decisions. In fact, part of why I stopped consulting for a while was so I could be home to help take care of her more, so I could take a job where I wasn't traveling as much. And so, which probably did affect where I'm at in my career because of it, because I would have probably been, at a much higher level if I'd stayed with that company, who I'm with now. But, so I lost any opportunities, I think, from that possibly. But did it have, did any of the, issues with her pain, did it have any effect on your career?
So what it did for me, it made me double down. So
Yeah.
when we first got married, actually when we met and when we first got married and all that, she had a job. But she was having difficulty with her jobs because of her illness. So she would call in sick a lot or call in late a lot. And that really, I know that influenced her ability to work. And at the time, the kids were in daycare, and daycare is super expensive. And we ran some numbers, and it just didn't make any financial sense for her to continue to work. So we decided that she would be a stay-at-home mom while I focus on my career, and try to, you know, just try to make as much money as possible. Which, you know, it's helped. I think it's helped a lot because there's a lot that she takes off my plate that allows me to do that. I never traveled to the frequency that you did. And I could not imagine traveling every single week, only being home like 3 days out of the week and then traveling the rest of the time. I could not imagine that, nor could we sustain that either. If I had that type of a job, I would be taking a step back from it too, right? Or at least that type of, that type of travel. But anyway, so yeah, so for me, I just kind of doubled down. Well, that's a wrap for today. Next episode, we've got a very, probably a pretty heavy duty type of topic to discuss. Something that's, so far we've been pretty personal, sharing some of the stories from within our lives, but I think this one's probably the most personal one of all so far. So Titan, what's coming up on the next episode?
We're going to keep it light for the next episode, and we're going to talk about death and how it's affected us personally, because we all know that's a light and fun topic. So we're going to talk about death, how it's affected us, and just like any other time, please let us know, any of your own stories of how it's affected you.
Right on. All right, everybody. Well, thanks for joining us again, and until next time.